Have you ever looked at blood report, seen uric acid and thought, okay, but what exactly does that number mean? Most people think uric acid matters only when a painful gout attack happens. But that's only part of the story. Because in gout, the real problem is not just pain. It is not even just number. The real story is about crystals. The crystals that can form silently, crystals that can trigger inflammation, and crystals that may continue to matter even when the pain has settled. And here is the important question. Is your uric acid merely high or is it low enough to stop crystals from forming? Today I want to explain clearly, simply and scientifically about this. In this video, you will learn what uric acid actually is, why humans are uniquely prone to higher uric acid, why gout is really a crystal disease and not just a high number disease, and why the 6 mg per deciliter matters, what can happen silently between the gout flares, how diet, fructose, purines, alcohol and metabolic health fit into the picture, and what the key take-home message is for the patients. And at the end, I'll give you a short key takeaway summary. So if you are short on time, you can directly skip to the key takeaway section at the end. But if you stay with me, the whole topic will make much more sense. Before we start, one quick note. This video is for education and awareness purpose only. It is not a diagnosis, treatment plan or personal medical advice. Please discuss your own symptoms, reports and treatment decisions with your own doctor. And now let us begin from the basics of uric acid. What is uric acid? Uric acid is a natural end product of human metabolism. Your body breaks down substance called purines. Purines are basically the building blocks which are available in every cell. Purines come partly from our own cell and partly from food. As purines are broken down, uric acid is formed. So uric acid is not automatically bad. It is a normal part of the biology. But humans have one important difference from many other mammals. Most mammals have an enzyme called uricase or uric oxidase, which breaks down this uric acid down further, much more soluble form, substance called allantoin. Humans and apes lost this functional ability, lost the functional uricase during the evolutionary period. That means the uric acid is much more likely to accumulate in us than in many other mammals. That evolutionary detail is simply fascinating. One proposed idea is that higher uric acid may once have offered us survival advantages in times of food scarcity, but in the modern environment of excess calories, processed foods, fructose-rich drinks, and metabolic overload, the same biology may become less helpful and sometimes harmful. This evolutionary framing is interesting, but it should be viewed as biological plausible explanation and not as the main clinical message here in this video. The main clinical message today is much simpler. In gout, uric acid matters because crystals matter. I should also explain you about another term called tophus or tophi. It just means a lump made of uric acid crystal that slowly gets accumulated, that builds up under the skin with long-standing gout. Take that as a small stone made of uric acid that forms inside the body, usually closer to the joints. Gout is not just a number, it is a crystal disease. This is one of the most important ideas in the entire video. Many people think hyperuricemia or high uric acid in the serum levels equals gout. That is not exactly correct. The more accurate statement is a persistently elevated uric acid can create the conditions for MSU, the monosodium urate crystals, to get formed, and those crystals are what drive gout. At body temperature and normal physiologic conditions, the urate becomes saturated around 6.8 mg per deciliter, and above that level the chance of crystal formation rises. So, when uric acid rises enough and stays elevated, the body fluids may become supersaturated with urate, and when that happens, the crystal forms in joints and soft tissues. That is why gout is not simply a high blood test problem. It is a crystal deposition and inflammation problem. And importantly, not every person with elevated uric acid develops gout. Reviews note that only a minority of people with asymptomatic hyperuricemia. Asymptomatic hyperuricemia means increased uric acid in the blood, go on to develop gout, which means other factors also influence whether crystals form and whether they trigger symptoms. Why does the gout often strike suddenly? Once the crystals are formed and then it is shed into the joint, the immune systems then take over and then attacks or reacts to it. This is where the pain comes from. Monosodium urate crystals can activate a pathway called inflammasome, NLRP3 inflammasome, and which leads to caspase 1 activation and then release of cytokine interleukin 1 beta, a major inflammatory cytokine. The inflammatory cascade then attracts the neutrophil, the first line WBC's white blood cell, and produces the classic hot, swollen, and intensely painful gout flare. So the pain of the gout is not just uric acid floating in the blood. It is your immune system reacting to the urate crystals inside the joint. That is why a gout attack is so dramatic. And this also explains an important misunderstanding. When the pain settles, many people feel the problem is over, but that is not always true. What happens between the flares then? This is where the topic becomes especially important. Even in symptom-free periods, the gout may not be biologically silent. If the serum uric acid is chronically elevated or the environment is favorable for crystal formation, then the ongoing crystal formation, clinical inflammation, and joint damage can continue between the flares, and even when the patient feels well, patient feels I'm okay. Advanced imaging may detect damages that plain X-rays can miss. That means no pain does not always mean no disease activity. That's exactly why long-term gout management is not just about treating pain when it comes. It's about reducing the crystal burden. Now we come to the very center of this video. Why below 6 mg per deciliter matters. If urate saturation is around 6.8 mg per deciliter, why guidelines and reviews emphasize a treatment target of below 6 mg per deciliter? Because in real life, uric acid fluctuates, hydration changes, diet changes, illness changes, body chemistry changes. So aiming exactly at the saturation point is not safe enough. A target of below 6 mg per deciliter gives a practical safety margin below the saturation threshold, helping to reduce new crystal formation and promote dissolution of existing crystals. The reviews also notes that in more severe gout, especially with tophi or advanced disease, some guidelines use a lower target such as below 5 mg per deciliter to more rapidly improve signs and symptoms and accelerate crystal or tophus resolutions. So the logic is above saturation level, crystals are more likely to form. Below the target, the crystal formation is reduced. With sustained control, an existing crystal burden can gradually fall. That is why the target matters. What improves when the target is reached? When uric acid is lowered and maintained below target in gout, the expected benefits are fewer flares, less new crystal formation, gradual dissolution of existing crystals, shrinkage of tophi, better long-term joint protection. That is why modern gout care is usually described as treat to target approach and not just treat the pain approach. Reviews summarizing the ACR and EULAR based strategies emphasize lowering serum urate below 6 mg per deciliter for most patients and sometimes lower in severe disease. A very practical way to remember this is pain is the signal, crystals are the problem, target control is the long-term strategy. Where do diet, fructose, alcohol, purines fit in? Now let us widen the pictures slightly. Diet is not the whole story but definitely matters. Higher intake of alcohol, especially beers, fructose containing drinks, beverages that contain fruit sugars, and purine-rich foods can contribute to hyperuricemia and gout risk. Fructose is especially interesting. In 2005, Nagakawa paper argues that the fructose metabolism can raise uric acid and may contribute to endothelial dysfunction, insulin resistance, hypertension, and metabolic syndrome through this uric acid related pathways. This is an important mechanistic and hypothesis building paper, but it should be taken as an evolving science rather than a settled clinical proof. The practical message is reduce excessive sugary drinks, be cautious with alcohol, especially beer, be aware of high purine foods, and understand weight, blood pressure, kidney function, insulin resistance, and uric acid often travels together. But diet alone is not always enough to achieve gout targets in established diseases. That is one reason why proper medical evaluation matters. Does uric acid matter beyond gout? This is where we need balance. The broader uric acid literature suggests links with hypertension, kidney disease, metabolic syndrome, and diabetes. In 2018, Johnson et al. Paper, NKF workshops, support says experimental and epidemiological evidence that support these associations, but also state clearly that causality remains controversial and requires further study. Uric acid may be relevant beyond gout, but the strongest proven clinical message remains in gout and crystal disease. Everyone with mildly completely elevated uric acid needs treatment. And it's not saying every joint pain is gout. It is saying if you have gout or suspected gout, the uric acid target matters because crystal biology matters. When should someone talk to their doctor? Please consider discussing uric acid with your doctor if you have had sudden episodes of painful swollen joints, especially in the big toe, foot and ankle or knee joints. If you have recurrent flares, you have known gout, you have visible or suspected tophi, you have kidney stones or chronic kidney disease, or you repeatedly see elevated uric acid on blood testing and it has never been properly interpreted. Key takeaways from this video on uric acid and gout are: number one, uric acid is a normal end product of metabolism, but humans are more prone to higher levels because we lost functional uricase during evolution. Number two, gout is not just a high uric acid condition, it is a monosodium urate crystal disease. Number three, around 6.8 milligram per deciliter is the key saturation zone for urate. That is why gout management often aims for below 6 mg per deciliter and sometimes below 5 mg per deciliter more severe disease. Number 4, even between gout flares, crystals and inflammation may continue silent. So pain settling does not always mean disease process has fully stopped. Number 5, long-term goal in gout is not just relief of pain, it is the reduction of crystal burden, prevention of flares and protection of joints. Disclaimer, this content is intended only for public education and awareness. It does not constitute medical advice, diagnosis or treatment. Please do not start, stop or change any medication, supplement, diet plan or treatment strategy based on this video alone. Clinical decisions should always be made with your own qualified treating doctor after proper history, examination and relevant investigations. The video it does not promote any specific medicine brand or commercial product. The discussion here is based on published scientific literature and is presented in a general education context. If this video on uric acid finally makes sense to you, please like this video so it reaches more people who are confused about that one number on your blood report. Share it with someone who has gout, high uric acid, repeated joint swelling or a report they never fully understood. And subscribe if you want more evidence-based videos where we break down common health topics clearly, calmly and without unnecessary hype. And if you want these updates in a simpler, more direct format, you can also join my WhatsApp channel. I'll display the QR code on the screen. You can scan and join there. Thank you for being here. Take care of your joints, take care of your metabolic health, and I'll see you in the next video.